Welcome back. Let's cross down to Canberra now via Skype and catch up with Professor Peter Collignon from the Australian National University again. Good to talk to you, Peter. The news keeps getting better, doesn't it, in terms of what this nation is doing to keep the new rates of infection incredibly low?
Yes, it is. Our epidemic curve was already turning about the 27th of March or a bit earlier from what we'd mainly done before. But it keeps on falling and now reached quite a low level of about 50 new cases a day. And a lot of those are still to do with cruise ships and return travellers. The true locally transmitted cases that don't have any risk factor are still quite low, and in New South Wales continue to fall. So that's a good sign that we don't have a lot of community transmission here that's not related to known cases. And for instance, in my city of Canberra, of close to 500,000 people, we've probably only had 2 local transmissions over that whole period of time. So all the data from South Australia everywhere is suggesting with what we've done, and particularly our physical distancing, washing hands and washing hands, keeping away from work when you're sick and away from people that are sick, seems to be working, along with our very good public health officials that are finding cases, quarantining their close contacts and them, and plus all the issues we've had with return travellers. We're in a good place where probably Australia, I think, has done better than almost everywhere else in the world. Yeah,
it's looking that way. Now, tell me, there's talk now about eradication. Is it feasible that we could push this infection right out in our population so that with our tough border controls still, not letting people in, or at least quarantining anyone who comes in, we could actually have a fairly normal society and economy behind those international barriers?
Well, that'd be nice, but I think unlikely. If you look at South Korea's epidemic curve, it went down like ours, but they're still getting ongoing low numbers of cases. New Zealand, that's their plan, but so far, from what I can see, Australia is doing better with its epidemic curve than New Zealand, and they've got about 20 new cases a day, while we've got 50. But if you'd adjust that for population, it would seem that their lockdown hasn't really achieved the same results or any better results than what we have. Luckily, both our curves are going down. But my reason for not thinking we can eradicate this is that there is a lot of cases that only had mild infection. Yeah. I don't think they're going to go away. They're going to be there as a background, and that's why we're going to get recurrence of cases, particularly when winter comes, but particularly if we let slip the really important things that we've been doing. And so we're going to have to do those for at least 6 months, those basic things of washing your hands, hand hygiene, keeping your distance, the 1.5, 2 metres from everybody as much as you can. But continuing to do that, because, why do we expect this to go away? We're not expecting the common cold virus or influenza to go away with what we're doing. And in any case, if we say we do get rid of the virus, or New Zealand does, this is in the rest of the world widely and everywhere, and particularly in developing countries where it's not going to get under control. So for years to come, until there's an effective and safe vaccine that's given to the whole world, I think we're going to have a problem, because if we have anybody coming into the country, it's likely to be reintroduced, even if we do quarantine, but more likely it's going to be in low numbers of people here with such mild infections they don't notice. But at times when it goes to others, or it's in the wrong situation with the wrong crowds, we'll get outbreaks again, and we have to clamp on them quickly. And both what they're doing is containing it and mitigating it as much as possible, so we can get on with life as normally as possible, but still with quite reasonable restrictions for at least the next 6 months.
And this is what Scott Morrison is talking about today, the tracking down of any outbreaks and be able to hit them very quickly and isolate them. We've been good at that so far. And I suppose with continuing testing and tracking, that's the future for us as we relax some of the lockdown measures and improve that sort of response. We can safely go ahead under those sort of conditions for months to come. Is that the way you see it unfolding, without an opening up of the international barriers?
Yeah, I think the international barriers are down for quite a while, at least 6 months or more. But yes, within Australia, I think there is potential for relaxing a lot of the restrictions that are on. I mean, South Australia, for instance, will be a good test case. It has much less severe restrictions than Victoria, which is almost in a lockdown. And is there a difference between those two places? Because we need to learn from the data as it unfolds and do what maximises the ability to keep the virus down and outbreaks down, but also doing what is not too destructive to people's mental capacity, capacity, if you like, going sort of quite, unhappy because they're locked up at home, but also livelihoods and everything else we can to make life as reasonably normal as possible, but not to make us all into hermits for the next 6 months. I mean, we've already put an extra 1 million people out of work, and a lot of those people are going to be out of work, I think, for the next 6 months. We don't actually want to too much increase that, and the social problems and everything that will cause, particularly if it looks like it doesn't actually help that much in keeping the infections down. I don't actually think we should do what Sweden is doing, because they've got 1,200 deaths compared to our 60 deaths, and when you work it out on a per million population, their death rate is 50 times higher than Australia. But equally, Korea's got it pretty well under control. And I think their approach, which is much more like the Australian approach, is the way to go. And what we've done in Australia is much like the Korean approach. And so far it's worked. And the one advantage we've got over Korea, they're in winter and we're not. So I think it's very reassuring to see Korea can do this. And I think Taiwan, even though they're in winter and we're not. So I hope we don't get a big second wave in winter, that what we're doing, if we continue to do it, we'll keep it under control and let us function reasonably normally compared to what a lot of the rest of the world is now in.
Now, understandably, of course, we freed up a lot of capacity within the health system by banning elective surgery or delaying it and taking up a lot of the capacity from the private health system. Looks like the federal government or the National Cabinet's going to look at that next. Because we've managed this so well so far, we can perhaps look at getting back and looking after some of that elective surgery, which will be quite important for a lot of people around the country.
Well, I think it is. I mean, a lot of elective surgery is quite important for people suffering and in fact, even life sometimes with, operations you need. So we need to be able to do those and not put them all off for 6 months. Equally, I think it's been very wise from all the states and territories to increase their intensive care capacity, even build new hospitals, to take surges, and effectively for the Australian government to take over the private hospital system effectively is now an outreach of the public system. But equally, my mind is that's insurance.
Yeah.
I hope we never have to use that insurance. I hope in retrospect it was all, a waste of money, because that's what insurance is best if it is, you don't use it. But equally, if we've got some capacity, and particularly if we can turn it on and off for other functions, well, yes, we should look at not having idle beds there and staff with not as much to do as they can. And if that means we can do some elective surgery, particularly people that can get in and out of hospital quickly, so we can free up the beds if we need to, that's all and good. It's all things we need to look at, but measure the effects, the detrimental effects. Is it causing cross infections, et cetera, look what's going on in the community with more and more testing of individuals, and also, if it works, testing sewage so we can see what's happening in Sydney, Melbourne, Canberra, etc., to really get a good handle on what is happening in the community.
Fascinating stuff. Thanks so much for joining us again, Peter.
Thanks for having me.
Professor Peter Collignon there from the Australian National University. A lot there to look at as we go forward.